Hello, it's Matt Cash, lymphedema therapist with Lilly Clinic in Roanoke, Virginia, and I am lucky because this is Lily Pod number 2, second episode, and I am being joined with Alexis Manning, who is the co-owner and co-founder of Buffalo Lymphatic Management in Buffalo, New York. I'm a Steeler fan, but my second team, and lately I haven't been a Steeler fan, because we won't go into that, but Buffalo has always been my second team, even before they started doing good again. So
again, yes, you're right. You're forgiven.
Alexis, please introduce yourself to whoever's listening to Lily Pod number 2.
So I'm Alexis Manning. Like Matt said, I am one of the co-founders of Buffalo Lymphatic Management. I own it with my business partner, Philip, and we both came from 2 very different corners of the healthcare world. He was working at the Veterans Association, and I was working at Roswell Park as a lymphedema therapist, and we had this crazy idea. And I think we said to ourselves, if you build it, they will come, probably 1,000 times. And it turns out that has been true. So we've been open for about 5 years now. And we are the only standalone lymphedema clinic in Western New York. So we serve patients over 5 counties. And we're just super happy to keep growing and help as many people as we can.
That's amazing. 5 years. Went out on a limb, huh?
Yeah, that was scary. It was scary leaving a state job for that, let me tell you.
You don't have to tell me. I know it.
I know how you feel. We're a little loony when we become lymphedema therapists. So we definitely are a different breed of people, and I fully support that. I think we're awesome, but yeah.
I must agree. We have to be a different breed of people. Can you tell me what inspired you to be a different breed of person? What made you become a lymphedema therapist?
So my dad, sadly, my father's passed away now, but he had lymphedema pretty severely. We grew up in a very rural area of New York, out in the Finger Lakes area, which is gorgeous. But there was no lymphedema therapist out there, obviously. So he unfortunately suffered with wounds and weeping, chronic venous insufficiencies, and blood clots pretty much his entire adult life. And eventually they got pretty infected. He would go to wound care. They would do the things wound care does, which is, wrap, but they never treated the root cause. And he passed away from unrelated things, but he never really fully got the care for that. So when I went to school and I found out as an occupational therapist, you can do some subspecialties, and lymphedema was one of them. I thought it was a fantastic idea. And I did one of my in-services with my now business partner. So that's kind of how we met, and we branched off from there.
So you might actually be a really good person to ask this question because of your life experience, and I'm sorry to hear about your father.
Thank you.
But what do you think is one of the biggest misconceptions that people have about swelling that we call lymphedema?
Yeah, the biggest misconception that I see here is that patients, they don't see it in the early stages, and they just think that it's not lymphedema or labeled as lymphedema as long as they don't have these really progressive skin changes and wounds and things like that. But I try to tell every patient, it actually starts pretty nefarious and pretty silently, and swelling in the ankle and the feet by the end of the day is one of your first signs of that. So I can't tell you how long my dad experienced that before it ended up, turning into this very severe case of lymphedema, which then, was untreated. So that's probably the biggest misconception I see. Or they think that they can treat it themselves with washes and other things that they see on social media, which, I have no problem with as long as they're used correctly. But I think that's probably one of the biggest things recently I've seen in my office.
Why do you think early treatment matters?
Early treatment is the key to success. As you are well aware, the sooner we can get to it, the faster we can take care of it. They even consider stage 1 lymphedema to be, reversible in the sense that you can get that leg back down to a normal size, or arm, or whatever body part is affected, as long as it's treated quickly. If I had my way, and this is kind of how I was when I worked in the hospital, I put sleeves and stockings on everybody that was at risk. So I have always believed we're doing a better job at preventing than we are at remediating. I would much rather do prevention work than remediate. And I know the patients would definitely do that as well. So the earlier you catch it, the better off you're going to be.
Yeah, I've been working on a presentation. I was supposed to present at the National Lymphedema Network conference, and it got I don't know what happened. They canceled it, so it never happened. But I've been working on this presentation, and it keeps developing, especially in my head, about early prevention. And first we have to recognize it, right? So providers need to recognize what it looks like. And I'm uncovering these stats that are relatively recent. 190 Americans have venous insufficiency. The number one cause of lymphedema is not breast cancer, like we've thought forever. It is venous insufficiency. And they're saying about 1 in 30 people have lymphedema. And I suspect, I have a very strong suspicion that it is more like 1 in 10.
Oh, yes, I would agree with you. I mean, all you really have to do is go to the store today, right? Walk around. It's summertime. People are wearing shorts, they're wearing sandals. You could find, I would say, if I really did this, I could go to the store and pick out at least 20 to 30 people walking around that have something going on easily.
Yeah, I, as a therapist, I find it really frustrating, and I assume you probably do too, especially with what you grew up with your father dealing with it. Very real example. But I find it incredibly frustrating because you're 100% correct. If I'm in the supermarket, and now my wife, she's actually like, they have lymphedema. She doesn't know anything. She doesn't know anything about it other than she lives with me, and it is sad. You can almost carry around a stack of business cards and keep handing them to people. But my frustration is why aren't providers seeing what we're seeing? That's where my frustration lies.
I know it feels almost like lymphedema is a 4-letter word in the healthcare community, in a sense, just because nobody wants to truly label it as that. But we have to kind of unattach that stigma from the name of lymphedema, right? Because so many people do have it. It's such a risk factor for people, and it's detrimental to their quality of life. Like, we need to start taking ownership for, some of the procedures that are done, having the potential to cause this for patients. We need to broaden our education to the general population that this might be something that they might experience later on in life. And providers as well. Like, I love my providers that I closely work with, but I have certainly worked with providers that have outwardly told me they don't have lymphedema. I don't do that. They'll send them off to, wound care or the vascular surgeons, which is great because then they finally find their channel to us. But we need to educate not only the general population, but the providers in the community as well, because they don't get much education on it. Even we didn't get much of an education on it. I don't know how you felt in school, but I got a slide on one PowerPoint. It was related to breast cancer and how you can get lymphedema from breast cancer. And then the slide switched immediately after. And that was it. So without my life experience, I never would have known about this. I never would have become a provider. So it's systemic.
I learned of it 5 years after I graduated by a patient that had severe lymphedema. And she said the word lymphedema, and I said, what? I've never heard of the word. And that needs to change. So I have a strategy for patients. I'm curious if you have a strategy for patients. Patients, I see their comments and like, how do we get to a lymphedema therapist? My doctor won't listen to me. Do you have a strategy to help patients get to you?
I do. I call it leading a horse to water. So I have patients that obviously self-refer themselves to me, right? Because they know something's going on. They've gone online and they've done education and they've got something, to make them think that they have this disease. So they'll come in for an evaluation and I'll say, who sent you here? It's one of my first questions. And they'll typically say, I did. So if they really truly need this like diagnosis on their medical chart, which they absolutely do, I tell them, why don't you bring research with you to your doctor's appointment? Print out anything that you can find or show them these articles. Or, I give them my evaluation so that their provider can read it. Any sort of information that you can bring to your provider is helpful so that they can make the correct diagnosis. I understand it. Primary care can't know everything. They just can't. They treat general things. So the more information you can provide them so that they can do their own research further and be able to give you the correct diagnosis and send you to the right channels is the best thing that you can do for yourself. Always self-advocate, always.
Yeah, it's perfectly normal to ask questions. And, I don't want to get into the diuretic discussion necessarily, but that's something I talk to my patients about all the time because they're mostly always on it. And if you have congestive heart failure, yes. But if it's solely prescribed for lymphedema, where's the evidence to say it does anything? And that's what I tell my patients is, hey, go back to your provider, because that's good. That's a good avenue for education, hopefully for them too. It's like, hey, doc, you give me this drug, it ain't working. What else can we do? And hopefully they could look into it. But awareness is key, I think.
Oh, absolutely. I agree with you.
So with that, this is a pretty easy question now. We kind of addressed it, but what do you think what would you wish that every healthcare provider knew about lymphedema?
I wish every healthcare provider knew the warning signs, right? Like the red paint on the wall that was coming at them. So if your patient is coming to you and telling you, hey, by the end of the day, my feet are kind of swollen, but the next day it's gone. Or, my rings don't fit by the end of the day. Do you know why that's happening? That is almost for me, obviously, because this is what I do for a living, but that's an immediate trigger for a referral to a specialist, right? Even if we aren't truly in the stages of true lymphedema yet, it's still an edema problem of some sort. So if there's no reason for that patient to be experiencing this, right? Like you mentioned, congestive heart failure, then we need to send that patient on further to a specialist that has a little bit more education on why that might be happening, because that's literally the first sign that many of these patients come in with to me and tell me, like, my feet have been swelling for a long time, but this didn't start happening until, like 6 months ago, 4 months ago. So I wish every provider was more open to letting that, light bulb flicker above their head that something might be going on, because that is really how we start down that avenue of preventative care, because we can stop it right then and there.
I've had, it's interesting to watch the evolution of a provider, because I have seen that, and I'm assuming probably you've seen that too, where they do send, or a patient will go back to them like, can you send me to this clinic? And then they do, and the doctor doesn't know much about it, but then the patient goes back and the doctor sees what has happened.
Yes.
And is like, oh, and then the next thing you know, you're getting referrals faxed to you much more frequently by that same provider.
That is the best marketing any therapist can do for themselves, is just to do a good job.
Outcomes truly matter. They truly do. Do you have any specific words of wisdom for your patients?
Yes, words of wisdom. Yes. So, my biggest word of wisdom is I get patients into custom compression stockings. That is the number one thing you're supposed to do. That's what we're taught to do. I don't know where many therapists get lost in the sauce on that. That is our training, right? So custom compression stockings are the number one thing. I don't let any of my patients leave without it unless there is a significant reason for it. So I impart that wisdom on every patient. This is what's going to keep you maintained. This is durable medical equipment, is what is designed to do for you. And you need to get into this to best maintain your chronic disease. I do have a love for off-the-shelf compressions when they're used correctly, but as far as my severity of populations, typically stage 2, stage 3, by the time they end up in my office, we're going to customs.
I was not expecting that answer, and you can't see the way this works is when I'm talking, they only see me, but I'm like cheering, because the biggest complaint that my patients come in with is, well, there's a few of them, but one of the regular ones is, I can't wear compression. It hurts.
Yep. Same here.
Because it's not the right compression.
Exactly.
And yeah, flatten it is the correct compression.
It is. We do that all day.
If you're listening to this and you're curious, the first episode was with the DME provider, durable medical equipment provider, Terry McClanahan, who goes through that process on that. So if you're curious, I'd go back and listen, because if you have lymphedema, you deserve the best of the best. You truly do deserve it.
Yeah.
Is there any success stories with the patient that might stick out for you?
Yeah, actually, I still do treat her on occasion, but I had a lady right after I came back from maternity leave. I felt like that eval was my first one after I came back with my second daughter. And I felt like we were both going through a war, right? 'Cause, you know, I'm like tired, brand new baby in the house. She comes in, she's tired. You can just see it on her face. She's weeping everywhere. I had chuck pads under her legs during this evaluation as she like literally dripped on the floor. You know, she's crying. She said that she's being sent to wound care. They're giving her these supplies that she really doesn't know how to use independently. She is weeping all over her clothes, her floors, her bed. And she has become, you know, kind of like my family because I've treated her for so long at this point. But I treated her right away. We got her in 5 days a week. She started undergoing bandaging. The leg stopped weeping within a couple of weeks. She experienced a significant reduction. She ended up losing 20 pounds. She was able to be more mobile. She stopped using her walker and went to a cane. And now she's very happily managed. Not to say that she doesn't still see me, because she absolutely does. She has to, just because her case was so severe. But she is so much happier, and you can just see the relief and happiness on her face now when she walks in the office, and it's not that look of despair that she had when she started. And it's just like, those are the cases that always stick with me, because I know we did the right things, right? Like, everything was done start to finish the right way, and that patient's quality of life is so much better.
We are trained with complete decongestive therapy as our gold standard treatment. That's what lymphedema treatment is supposed to be. That's where our evidence lies. And I think that's why I do showcase some of my patients in some of my videos, because I want people to see how severe it is, but what it can become.
Yes.
With good therapy. And there's a lot of people that talk about their legs weeping, that lymphorrhea, and that's a significant risk for infection when that's happening. Cellulitis, wound development, that fluid is caustic, so it's eating away your skin as it's draining out. But what people I don't think realize is, with appropriate treatment, you could turn that faucet off so fast.
It happens. Sometimes you can turn it off in a session.
Yeah, right. Most of the time. Yeah. Our work, I'm going to pat you on the back, seriously, because our work, we do amazing work. And I do feel like lymphedema therapists should be put more on a pedestal. And I know that's kind of, you know, I guess I'm bragging a little bit, but I truly believe that, because I don't know of, and I'm sure there's other therapies, so don't come at me, but I don't know of any other therapy that has the ability to change someone's life so dramatically.
I agree with
therapy.
We do. We're out here, we're in the trenches, but we're doing it for others. And there's nowhere I'd rather be.
How do we raise awareness? What's your trick to raising awareness? Because that's what this is all about.
We are doing it, Matt. The more that we can talk and the more that we shout it from the mountaintops, you know, the better off we're going to be. Personally, here in Buffalo, I do a lot of in-services and provider offices. I mean, we're very busy, we're booked out, but I still take time out of, you know, a couple days a month to go to these offices and talk to them about risk factors, what patients they might see, what would be a typical thing for them to walk in their office, just so that they're aware. And that's just my small community that I have here in Buffalo. But if every lymphedema therapist, wherever they're located geographically, could do that, that would raise awareness to providers. But on top of that, I also host a support group every month for patients that have lymphedema and lipedema to come and share stories. It's very helpful. We share education with each other, resources and referrals to surgeons around the country if anybody's seen somebody else. And it's helpful for me as well to kind of keep track of the therapists that kind of, you know, pop in and out of the community, so I can send people that are more closer located to them. So the more we do in our communities to speak out, I mean, we are changing our individual communities as much as we can. But what you're doing, Matt, specifically is 100% going to raise awareness, because you reach such a wide, you know, array of people through social media. And many of us therapists don't like social media or being the showcase on it. I don't either. But it's a sacrifice we have to make, right? Because we're out here to change lives, and this is absolutely what we have to do. We have to be visible and in the public so that we can teach people and change the course of this therapy.
You are doing amazing work. Sidebar, I actually don't like social media.
I don't either. I'm the worst millennial ever. I have no idea what's going on.
I don't even know what I'm doing right now. This is totally organic. We're just going with it. So but I might probably reach out to you because as Lily Clinic continues to grow, I'm anticipating expanding my space at the end of the year, beginning next year. And my wife is a yoga instructor, and she's currently taking adaptive yoga classes.
Oh, that's
And
awesome.
I hope she doesn't listen to this because she's not going to be happy when I say this. But the goal is in the future, she's going to start offering yoga classes to people with lymphedema, lipedema, or anybody community. Hopefully in my clinic, there's going to be an open space for that. As well as that open space, I also would like to start a support group for people too. So I will probably, if you're cool with it, reach back out to you because I will definitely have some questions about that.
It's super fun. I look forward to it every month.
So let's end on a positive note, which we kind of already are. I think that's our nature as lymphedema therapists. We have to live in positivity. But what do you think is going well in the world of lymphedema right now today?
So I've even noticed, I've been practicing for 7 years, and I've noticed over the course of just the short 7 years I've been doing this, that we've almost gone from like the dark ages into this like moment of reality, especially here in Buffalo. There's this running joke, don't tell anybody, but Buffalo's the last to hear about everything, which, it may be true, but I have noticed so much more advocacy online. And while I do not enjoy social media personally, I think it's absolutely incredible. Patients and therapists and everybody in the community that goes out and talks about it as much as possible, because we really are reaching a wider audience through advocacy that way. So I think that's going well. I also am absolutely thrilled with the advancements to surgical interventions. So I'm very close to ECMC, so Erie County Medical Center, and we are extremely lucky to have 2 plastic surgeons that specialize in microsurgery here. So I have a very close resource to be able to send patients that are very severe and might need a surgical intervention to them. And it's been amazing to watch how those surgeries have advanced and improved over the course of the few years that they've been available to patients. And there's so many amazing things coming down the pipeline as far as clinical trials with them as well that I just cannot wait to see the outcomes of. So I really do think that we're growing and we're becoming so much more, we're just more, right? We're able to help our patients more than we were previously. So I love to see new advancements. I'm always looking out for new studies and anything I can get my hands on.
Well, unplanned, but I'm in the process of setting up the 3rd Lily Pod with a patient who's 18 months out from several different surgeries.
Gonna love it.
So stay tuned for that. I'm excited to talk to her about that and learn, honestly. I'm in the world of complete decongestive therapy. I know there's these surgeries. I read about them a little bit, but I'm ignorant because I'm in the day-to-day. So I'm really looking forward to that. And I know you don't like social media, but thank you because you're about to be on social media.
That's fine. It's a worthy cause.
I am very grateful that you decided to do this. It is with all of my being. I truly think that awareness is the key to success for this population at this point. And then you're right. The more that we're talking about it, the more that we're screaming it from the mountaintops, the more people are hearing it. And hopefully this weird word lymphedema becomes more of a household term because it should be.
I agree.
So thank you so much, Alexis, from Buffalo Lymphatic Management in Buffalo, New York. Go Steelers.
Don't you dare. Thank you, Matt. Have a good one.
Bye.